Good day, everyone. I am Dr. Mark, and you are watching Dr. Mark Official. Today, we're discussing important health warning signs. Today, I want to talk about something many people overlook, their feet. We walk on them every day, we stand on them, we depend on them, but rarely do we actually examine them closely. Surprisingly, your feet can reveal early warning signs of a serious health condition, diabetes. Diabetes often develops quietly. In many cases, the body sends signals long before a diagnosis is made, and some of the earliest signs appear in the feet. Recognizing these warning signs early can make a life-changing difference. Here are 9 warning signs in your feet that could mean diabetes and should never be ignored. First, numbness or tingling. Numbness or tingling in the feet is often one of the earliest and most common warning signs associated with diabetes. Many people describe it as a pins and needles sensation, a mild buzzing feeling, or a creeping numbness that starts in the toes and gradually spreads upward. At first, it may come and go, perhaps noticeable only at night or after sitting for a long time. Because it can feel minor or temporary, it is easy to ignore. However, this sensation may signal the beginning of nerve damage caused by consistently high blood sugar levels. Over time, excess glucose in the bloodstream can injure the tiny blood vessels that supply oxygen and nutrients to the nerves. When these nerves do not receive proper nourishment, they begin to malfunction. As a result, messages between the feet and the brain become disrupted. This can lead not only to tingling, but also to reduced sensitivity to pain, temperature, and touch. A person might step on something sharp or develop a blister and not even realize it. Without normal sensation to warn you of injury, small problems can quickly become serious, leading to infections or complications that are much harder to treat. Second, burning or sharp pain. Burning sensations or sharp stabbing pains in the feet can be another early warning sign linked to diabetes. Many people describe the feeling as if their feet are on fire, exposed to extreme heat, or being pricked by tiny needles. These sensations often become more noticeable at night when the body is at rest and there are fewer distractions. What makes this symptom particularly distressing is that it can interfere with sleep, causing discomfort that lingers for hours and affects overall quality of life. This type of pain is commonly associated with nerve damage resulting from prolonged high blood sugar levels. When glucose remains elevated in the bloodstream, it can damage the delicate nerve fibers responsible for sending signals between the feet and the brain. Instead of transmitting normal sensations, the damaged nerves may send exaggerated or false pain signals. Even light contact from bed sheets or socks can feel unbearable. In some cases, the pain may alternate with numbness, creating a confusing pattern of reduced sensation mixed with intense discomfort. Ignoring these symptoms can allow the nerve damage to progress, potentially leading to more severe complications and greater difficulty managing the condition over time. Third, slow healing cuts or wounds. Slow healing cuts or wounds on the feet can be a serious warning sign that should never be overlooked. What may begin as a tiny blister from tight shoes, a small crack in dry skin, or a minor cut from trimming toenails can turn into a lingering sore that refuses to heal. In a healthy body, the healing process starts quickly. Blood rushes to the injured area, delivering oxygen, nutrients, and infection-fighting cells to repair damaged tissue. However, when blood sugar levels remain high, this natural repair system does not function properly. Diabetes can damage blood vessels and reduce circulation, especially in the lower extremities like the feet. With less blood flow, wounds receive fewer essential nutrients and less oxygen, slowing recovery. At the same time, high blood sugar can weaken the immune system, making it harder for the body to fight off bacteria. As a result, even a small wound can become infected, grow larger, or develop into an open sore known as an ulcer. Because nerve damage may also reduce pain sensation, a person might not even realize the injury is worsening. Without prompt care, these wounds can lead to serious complications that are much more difficult to treat. Fourth, frequent foot infections. Frequent foot infections can be an important warning sign that something deeper is affecting your overall health. While occasional infections such as athlete's foot or minor bacterial issues can happen to anyone, infections that occur repeatedly or refuse to fully clear up may signal a problem with blood sugar control. High blood sugar creates an environment where bacteria and fungi can thrive. Excess glucose in the bloodstream can also be present in body tissues, providing more fuel for harmful microorganisms to grow and spread. At the same time, elevated blood sugar weakens the immune system. White blood cells, which are responsible for fighting infections, become less effective when glucose levels are consistently high. This means the body struggles to defend itself against even minor invasions. A small crack in the skin, an ingrown toenail, or a tiny blister can quickly develop into a more serious infection. Symptoms may include redness, swelling, warmth, pain, pus, or an unpleasant odor. Fungal infections may cause itching, peeling skin, or thickened, discolored toenails. When infections keep returning despite treatment, it may be a sign that the underlying issue, such as uncontrolled blood sugar, needs immediate medical attention and proper management. Fifth, swelling in the feet or ankles. Persistent swelling in the feet or ankles can be more than just a temporary discomfort. It may be a signal of underlying circulation problems often associated with diabetes. When blood sugar levels remain high over time, they can damage blood vessels, making it harder for blood to flow efficiently to and from the lower extremities. As circulation becomes impaired, fluid can accumulate in the tissues, leading to visible swelling, also known as edema. This swelling may cause the skin to appear stretched or shiny, and shoes or socks may suddenly feel tighter than usual. Poor circulation not only causes fluid buildup but also limits the delivery of oxygen and essential nutrients to the tissues. This can make the feet more vulnerable to injury and slow down the healing process if wounds occur. In some cases, swelling may be accompanied by a feeling of heaviness, tightness, or mild discomfort. If the swelling worsens throughout the day or improves slightly after elevating the legs, it may further suggest circulatory issues. Since diabetes can also affect the heart and kidneys, ongoing swelling should never be ignored. Monitoring changes and seeking medical evaluation can help prevent more serious complications and support better long-term health outcomes. Sixth, dry, cracked skin. Dry, cracked skin on the feet may seem like a minor cosmetic issue, but it can be an important warning sign of underlying problems linked to diabetes. Healthy skin naturally produces oils and sweat that help keep it soft, flexible, and protected. However, when blood sugar levels remain high for long periods, nerve damage can affect the sweat glands in the feet. As a result, the skin may lose moisture and become unusually dry, rough, or flaky. When dryness becomes severe, the skin can begin to crack, especially around the heels or between the toes. These cracks may appear small at first, but they can deepen and become painful over time. Even tiny openings in the skin create entry points for bacteria and fungi. Because diabetes can also weaken the immune system and slow healing, infections can develop more easily and become more serious. In some cases, what starts as a simple crack can progress into redness, swelling, or even an open sore if left untreated. Regularly checking the feet, keeping the skin moisturized, and addressing dryness early are important steps in preventing complications and maintaining overall foot health. Seventh, changes in skin color. Dry, cracked skin on the feet may seem like a minor cosmetic issue, but it can be an important warning sign of underlying problems linked to diabetes. Healthy skin naturally produces oils and sweat that help keep it soft, flexible, and protected. However, when blood sugar levels remain high for long periods, nerve damage can affect the sweat glands in the feet. As a result, the skin may lose moisture and become unusually dry, rough, or flaky. When dryness becomes severe, the skin can begin to crack, especially around the heels or between the toes. These cracks may appear small at first, but they can deepen and become painful over time. Even tiny openings in the skin create entry points for bacteria and fungi. Because diabetes can also weaken the immune system and slow healing, infections can develop more easily and become more serious. In some cases, what starts as a simple crack can progress into redness, swelling, or even an open sore if left untreated. Regularly checking the feet, keeping the skin moisturized, and addressing dryness early are important steps in preventing complications and maintaining overall foot health. Eighth, unusual coldness in the feet. Unusual coldness in the feet can be a subtle yet significant sign of circulation problems often linked to diabetes. While it's normal for feet to feel cold in chilly weather, constantly cold feet, even in warm environments, may suggest that blood is not flowing properly to the lower extremities. Healthy circulation ensures that warm, oxygen-rich blood reaches the tissues, maintaining normal temperature and function. When blood vessels become narrowed or damaged due to prolonged high blood sugar levels, this process is disrupted. Reduced blood flow means less warmth is delivered to the feet, causing them to feel persistently cold to the touch. Some people may also notice accompanying symptoms such as numbness, tingling, or a pale or bluish skin tone. In certain cases, one foot may feel colder than the other, which can further indicate uneven circulation. Because diabetes can also damage nerves, the ability to sense temperature accurately may be affected, making it harder to distinguish between mild and severe coldness. Persistent cold feet should not be ignored, especially if combined with other warning signs. Monitoring these changes and seeking medical advice can help identify circulation issues early and reduce the risk of more serious complications developing over time. Ninth, changes in the shape of your feet or toes. Changes in the shape of your feet or toes can develop gradually and may signal long-term nerve and muscle damage associated with diabetes. When blood sugar levels remain high over time, nerve damage, particularly peripheral neuropathy, can weaken the small muscles in the feet that help maintain proper alignment and balance. As these muscles lose strength, the tendons that control toe movement may become tight or unbalanced, pulling the toes into abnormal positions. This can lead to conditions such as hammer toes, claw toes, or toes that begin to curl downward unnaturally. In some cases, the arch of the foot may collapse, causing the foot to appear flatter or wider than before. These structural changes can alter the way weight is distributed when walking or standing. As pressure shifts to certain areas, calluses, corns, and sores may develop more easily. Because sensation may also be reduced, a person might not feel discomfort until significant damage has occurred. Over time, repeated pressure and unnoticed injuries can increase the risk of ulcers or infections. Noticing early changes in foot shape, difficulty fitting into shoes, or unusual pressure points is important. Prompt medical evaluation can help manage these changes and prevent further complications. These signs may seem small or harmless at first. A little numbness, a small crack in the skin, a wound that just needs more time, but together they can point to something much more serious. The key message today is simple. Don't ignore what your feet are telling you. Checking your feet regularly takes only a few minutes. Look for cuts, color changes, swelling, or anything unusual. If something doesn't seem right, seek medical advice early. Early detection of diabetes can prevent severe complications such as infections, ulcers, or even amputations. Your feet carry you through life. They support every step you take toward your goals, your family, and your future. Paying attention to them could protect not just your mobility, but your overall health. So remember, when it comes to diabetes, your feet might speak first. Make sure you're listening. Thank you for watching Dr. Mark Official. If you found this helpful, share it with others and stay healthy. See you next time.